Dakota Klein's downward spiral is like so many others. A car crash, prescribed pain medications, and then addiction.
They had him on Dilaudid, Percocet, Oxycontin, Opana.
Eventually, his doctor cut him off.
When you go through withdrawals like that, you feel like you're gonna die.
Dakota Klein passed away 7 months ago of an overdose. His family is convinced medical marijuana would have saved him.
If he had a constant supply of it, I don't think he would have ever relapsed.
And there are studies to suggest that's true. The University of California, San Diego found a 23% drop in opioid-related hospitalizations in states where medical marijuana is legal.
A drug that many people think is the gateway to hard drugs may actually be the exit door to some of the opioid epidemic problems we're facing now.
Dr. Mehmet Oz is one of the more vocal supporters of medical marijuana for chronic pain.
So many people who have been addicted have told me that it's helped them get off the medication.
But other doctors say the evidence is not there. Not yet.
I think it would be very speculative to say that marijuana use decreases opioid use or opioid deaths.
Others argue this can't be a state-by-state decision. In April, Nebraska State Senator Mike Hilgers listed some of the questions still unanswered.
What trials do we have? What is the proper dosage? Were these controlled studies?
The National Institutes of Health has awarded a 5-year grant to study whether medical marijuana can reduce opioid use among those with chronic pain. And several drug makers are developing marijuana-based painkillers. But for now, nothing derived from marijuana has been approved as a pain medication.
Well, I think medical marijuana should for sure be legalized. I think it would help a lot of people, especially addicts.
Aside from the development of drugs, either the federal government or individual states would have to approve marijuana for medical use. Nebraska does not permit the use of medical marijuana. Iowa allows limited use for cancer and other ailments, but not specifically chronic pain.